Hello friends, today I will talk about the stones in the ureter. This is the normal anatomy. We can see both the kidneys. This pipe which is coming from the kidney to the bladder is known as the ureter, and this is the bladder, and this is our urine passage. Stones are normally formed in the kidney, and from here they drops into the ureter. There are many factors for the formation of stone. It's very difficult to identify one factor. If you have recurrent stones, then your treating urologist may advise few tests to find out whether you have any factor which is the cause of recurrent stones. We can see here now one of the stone drops from the kidney into the ureter, and from here it have to travel this path. The ureter is about 25 centimeter long and it has to reach the bladder. Stone can stuck anywhere in the ureter. We can see in this picture a stone is stuck in the ureter. Now in which part of the ureter the stone is stuck, the symptoms depends upon that. If the stone is stuck in the upper part, you may feel pain in the flank, below the ribs, in the back. It may come anteriorly in the abdomen. You may feel vomiting. Some of the patient may have fever or even blood in the urine. If it is in the middle part, then again you will develop the colicky pain, the pain in the lower part of the abdomen, the flank pain, even vomiting. And if it is in the lower part of the ureter, along with the pain and all the symptoms, the pain can even go to the testis, the pain can go to the groin, and if it is very near to the bladder, it may irritate the bladder, which may lead to increased frequency of the urine. Every time you feel that you have to pass the urine, but when you go there, little urine comes out. This is because the stone is irritating the bladder, and there may be blood in the urine and fever also. Why you develop pain is because the stone is stuck here, and which prevents the normal passage of urine to the bladder. Some urine accumulates in the ureter above, in the kidney, and it swells up, and this swelling will cause the pain. Now we can see that the stone has to pass from the ureter into the bladder. Once it is in the bladder, 99.9% it is going to pass out through the urethra. How you diagnose it? Your treating urologist may undergo few tests, blood and urine test, ultrasound, and if needed, CT scan. Treatment. You should consult your urologist. So he will decide based upon the size of the stone and multiple other factors whether he will go for a conservative approach or he will advise you the endoscopic removal of the stone. If he advises you the conservative approach, he will prescribe you some medications which will facilitate in the passage of the stone, some medication to relieve your pain, and you need to drink a lot of fluids that will help in getting the stone out from the body. And then obviously you will need a repeat imaging to check whether stone is passed or not, or to know the present location. If you develop severe pain, you may even have to go to the emergency for the injectables. Now if the stone doesn't come out, obviously it has to be removed. It is removed endoscopically. An endoscope is passed from the urethra into the ureter, and then with the help of the laser, the stone is broken into small pieces and retrieved. So what are the things which you should keep in mind? That you should always consult your urologist. You should follow his advice. If there is any fever, report immediately, and don't wait unnecessarily for longer period of time, because the pressure on the kidney can have adverse effects on it. Now how can you prevent the stones? The most important thing is drink plenty of fluids. Drink at least 3 to 3.5 liters of fluids daily. So that will flush out any small calcium deposit which will happen in the kidney. Second is, please don't take extra salt. This is also important for your oral health. The people who are non-vegetarian, you should decrease your red meat intake. Although all majority of the stones are made up of calcium, but still we need calcium for our bone, and moderate amount of calcium intake prevent the stone formation also. So if you are not allergic to milk or you don't have lactose intolerance, you should definitely have at least a couple of glasses of the milk daily. And yes, one of the important thing is avoid weight gain. Please avoid obesity, which is also one of the causative factor in the formation of the stone. And if you are diabetic, please have a very good sugar control. And if you have formation of a stone, then you have 50% more chance of developing the stone as compared to the person who don't have the stone. So it's always advisable that please get an ultrasound done every 6 months or 1 year to know whether any new stones are formed or not, what is the size of the stone, where it is located, and then accordingly you can plan your treatment. Thank you and stay safe.